Today on Your Government in Action, where we cover bills, votes, records, and how it affects you. The Affordable Care Act changed how 47 million Americans get health insurance, and most of them still don't know exactly how. Here is a law that touched the lives of nearly every American, and most people still cannot explain what it actually does. The Affordable Care Act, signed in 2010, fought over for more than a decade, survived 3 trips to the Supreme Court, nearly repealed by one vote in 2017. Today we are going to break it down completely. What the law actually says, how it passed, and what it means for you, your family, and your wallet. Let's get into it. Let's start with the basics, what the Affordable Care Act actually says. The Affordable Care Act is roughly 900 pages long. That is a lot of legal text. But the core of the law comes down to a handful of changes that affect how Americans buy and use health insurance. The first big one: insurers can no longer deny you coverage because of a pre-existing condition. Before the ACA, if you had diabetes, cancer, or even a prior pregnancy, an insurance company could legally turn you away. That ended on January 1, 2014. The law also eliminated lifetime coverage caps entirely. Before that, your insurer could stop paying your medical bills once you hit a certain dollar limit, even in the middle of a serious illness. The second change: children can stay on their parents' insurance plan until they turn 26. That alone helped millions of young adults who would otherwise have gone without coverage. The third change: the law expanded Medicaid. Medicaid is the government health program for low-income Americans. The ACA allowed states to expand eligibility to adults earning up to 138% of the federal poverty level. Not every state took that option, and more on that later. The fourth change: the law created health insurance marketplaces. These are online exchanges where you shop for a plan the way you might shop for a flight. Plans are organized into 4 tiers: bronze, silver, gold, and platinum, based on how much you pay up front versus how much the plan covers. Subsidies come in the form of tax credits applied directly to your monthly premium. The credit is calculated using the cost of a benchmark silver plan in your area, and depending on your income, those credits can cover most or even all of your premium. Open enrollment runs typically from November through January each year. Now that you know what the law does, here is how it actually got passed, because the story is remarkable. The Affordable Care Act did not happen overnight. The push for major health care reform in America goes back decades. Presidents from both parties tried and failed to overhaul the system. Bill Clinton made it a centerpiece of his 1992 campaign. It collapsed in Congress in 1994, largely because of opposition from the insurance industry and concerns about government overreach. When Barack Obama took office in January of 2009, health care was at the top of the agenda. 46 million Americans were uninsured. Premiums were rising. People were going bankrupt from medical bills. The administration spent the better part of a year negotiating with hospitals, insurers, and pharmaceutical companies. They also tried to bring Republicans on board. There were months of bipartisan talks in the Senate Finance Committee, led by Senator Max Baucus. Republican senators, including Charles Grassley and Olympia Snowe, participated in those negotiations for much of the summer and fall. Republicans raised concerns about the cost of the bill, the expansion of federal power, and a proposal that would have created a government-run public insurance option. That public option was ultimately dropped, in part to win over moderate Democrats. In the end, no Republican votes materialized in either chamber. The Senate passed the bill on December 24, 29, Christmas Eve, by a vote of 60 to 39. Every Democrat voted yes. Every Republican who voted no. One senator did not vote. The House could not vote on the Senate version directly, so Democratic leaders used a budget process called reconciliation to make adjustments and pass the final package. The House passed the bill on March 21, 2010, by a vote of 219 to 212. 34 Democrats voted against it. Not a single Republican voted for it. President Obama signed the bill into law 2 days later, on March 23, 2010. The moment it was signed, legal challenges began. The law faced its first Supreme Court test in 2012. In a case called NFIB versus Subsidies, the court upheld the core of the law, 5-4, with Chief Justice John Roberts writing the majority opinion. It survived again in 2015 in King versus Burwell, and again in 2021 in California versus Texas. The vote numbers tell one story, what happened after tells another. Let's look at those votes a little more closely, because they matter for understanding everything that came after. In the Senate, 60 Democrats voted yes, 39 Republicans voted no, 0 Republicans crossed the aisle. In the House, 219 yes, 212 no again, 0 Republicans. 34 Democrats actually voted against their own party's bill. That tells you how controversial this was, even within the Democratic Party. The law passed on a strictly party line vote, the first major social legislation in American history to do so. Medicare in 1965 passed with Republican support. Social Security in 1935 passed with Republican support. Not the ACA. From the moment it passed, Republicans pledged to repeal it. They held more than 60 repeal votes in the House over the following years. None of them made it through the Senate while Obama was president. Then in 2017, with Republicans controlling both chambers and the White House, full repeal seemed inevitable. The House passed a repeal bill in May 2017. It went to the Senate, and there it died. The Senate vote on what became known as the skinny repeal was 51-49. 3 Republican senators voted no: Susan Collins of Maine, Lisa Murkowski of Alaska, and John McCain of Arizona. McCain cast the deciding vote, a dramatic thumbs down on the Senate floor on July 28, 2017. That one vote kept the ACA alive. The individual mandate, the requirement that you buy insurance or pay a fine, was effectively ended later in 2017 when the tax bill zeroed out the penalty to $0, but the rest of the law remained intact. So the law survived. Now let's talk about what actually changed in the real world once it took effect. Before the ACA, the uninsured rate in America was 16%. That means roughly 1 in 6 Americans had no health insurance at all. By 2022, that number had fallen to 8%. That is a drop of half, according to data from KFF and the Department of Health and Human Services. Over 21 million people gained coverage in the first decade of the law. Today, about 40 million people are enrolled in Medicaid or the Children's Health Insurance Program, a number that grew significantly because of the ACA's Medicaid expansion. Marketplace enrollment also grew over time. In 2024, more than 21 million people signed up for coverage through ACA marketplaces, the highest number since the exchanges opened. Subsidies were expanded under later legislation, making premiums lower for a wider range of incomes. But here is where it gets complicated. The Medicaid expansion was optional for states. The Supreme Court ruling in 2012 said the federal government could not force states to expand, so states got to choose. As of 2024, 39 states plus Washington, D.C. have expanded Medicaid. 11 states have not. If you live in one of those 11 states and your income is too low to qualify for marketplace subsidies but too high for your state's existing Medicaid program, you fall into what is called the coverage gap. You do not qualify for Medicaid and you do not qualify for subsidies. You are essentially left out. The states that chose not to expand are mostly in the South and parts of the Midwest. When the individual mandate penalty was zeroed out in 2017, some analysts expected enrollment to drop sharply. It did dip in the years that followed, but then climbed back to record highs once enhanced subsidies were put in place. Lifetime coverage caps, the limit insurers used to put on how much they would pay out over your lifetime, those were eliminated entirely. So if you have a serious illness and rack up significant medical costs, your insurer can no longer cut you off after hitting a dollar limit. That's the big picture. Now let's make it personal. What does this actually mean for you? If you have ever had a pre-existing condition, a chronic illness, a past surgery, a mental health diagnosis, you are covered because of this law. An insurer cannot turn you away, cannot charge you more because of your history, and cannot drop you when you get sick. If you are under 26 and still on your parents' insurance plan, that is the ACA. If you have ever shopped for insurance on healthcare.gov or your state's marketplace, that is the ACA. And if your income is below 4 times the federal poverty level, roughly $60,000 a year for a single adult as of recent guidelines, you qualify for subsidies to help pay your monthly premium. Those subsidies can be significant. A family earning around $50,000 a year could see their monthly premium reduced by several $100s, depending on where they live and what plan they choose. ACA plans also come with out-of-pocket maximums. That means there is a legal cap on how much you can be required to pay in a given year for covered services, even if your medical costs exceed that amount. In 2024, that cap was around $9,000 for an individual. If you have a high-deductible bronze plan, your costs are lower each month, but you pay more before coverage kicks in. Silver plans often qualify you for extra cost-sharing reductions if your income is low enough. If you are on Medicaid because of the expansion and live in a state that chose to expand, your coverage exists because your state opted in. If you are in one of the 11 states that did not expand, you may have fewer options. Preventive care is another key change. Under the ACA, insurers are required to cover a list of preventive services at no cost to you. That includes things like annual checkups, certain cancer screenings, blood pressure checks, and vaccinations. You do not pay a copay for those. The law is not perfect. Premiums still vary widely. Out-of-pocket costs on bronze plans can be high. The coverage gap in non-expansion states is a real problem that affects real people. But the baseline protections, no denials for pre-existing conditions, no lifetime caps, dependent coverage to 26, those apply to everyone in every state, regardless of where your politicians stood on the vote. According to the Kaiser Family Foundation, the ACA remains one of the most significant shifts in American health coverage since Medicare was created in 1965. The Affordable Care Act is still law today. It has been challenged, nearly repealed, and debated in every election cycle since 2010. Whether you think it went too far or not far enough, the facts are clear. Millions more Americans have coverage now than before it passed. That is the record. If you want to know how your representatives voted on it, check the links in the description. Subscribe to Your Government in Action for more breakdowns like this, bills, votes, and how they affect you.